Tag TV and Tag Radio. Be seen and heard by both technology users and technology producers throughout the state of Georgia and around the world. Low cost, big benefits, powerhouse online branded video and audio has arrived. Tag TV, Tag Radio, there's a lot more to know. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Individual private health care. The issue of reform has and continues to be a topic of intense debate. From the White House to the Congress and Senate, presidential candidates to media pundits, Generation X to baby boomers. Yet, rarely do you hear insights into an even greater challenge inherent in the healthcare reforms of tomorrow: public health. The science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, public and private, community and individual. Greetings, everyone. It's Thursday, December 8th, 2011, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. Up to the Tech Talk, strategic planning and delivery of IT solutions for public health organizations. As we meet 20-year-plus industry executive and vice president of SRA International, Wayne Myers. SRA, with more than 7,000 employees in more than 50 locations worldwide, is dedicated to solving complex problems of global significance for government clients, in defense, in homeland security, health, and in civil agencies. As VP of SRA International, Wayne currently manages a portfolio of federal health consulting projects, primarily serving the CDC and the National Institutes of Health. The role of public health in the nation's reform priority of the healthcare industry and the significance of the technology's role in the strategic planning and delivery of tomorrow's healthcare solutions, as the Tech Talk takes a look at the transformation of public health, its role and its purpose in the digital economy of the future, as we speak with SRA International Vice President Wayne Myers. Wayne, welcome to Tech Talk.
Thank you.
Well, I think, one of those best-kept secret type of situations. I know that probably a lot of our listening audience, a lot of TAG members that are involved in IT and certainly in the healthcare space are familiar with SRA International. I think they might be surprised to know you got 7,000 employees across North America and Europe, but maybe give us a little bit of as they often say, a 40,000-foot perspective as to what SRA International is all about.
Sure. So we're a consulting organization, and we've been working for the past 30-plus years, primarily with the federal government, focused heavily on information technology and program support services. So about half of our work is in the military and intelligence sectors, where we build, support applications, and networks, both domestically and sometimes in the military theater. And then the other half of our work is with the civil government. So we have a large focus in that part of the business on health. And when you put health and federal together, we have a lot of work with CDC, the National Institutes of Health, FDA, and the like. So we provide all kinds of not only IT system development support, but also subject matter expertise in things like epidemiology, communication, statistics, research, and then some other IT-focused areas like cybersecurity and high-performance computing and the like.
Well, it's pretty impressive. One would think that, one of the things I often say, it's the same thing, only different. That technology often can deal with a spectrum of different complexities and different verticals, and yet a lot of cases, while the solution seems to be the same thing, only different. And that's not to minimize it, but it is to say that even though you're involved in what looks like an eclectic spectrum of different verticals, in reality, I'm sure there's a lot of interrelationship and a lot of best practices and just general knowledge about the evolution of IT that makes an impact on the deliverables that you have for your clients.
Yeah, that's absolutely right. And the federal government has its specific pace. It's a little more deliberate, perhaps, than commercial, but it certainly is
I like that. I like the way you say that. Deliberate. That's
yes.
More deliberate. I got you. I think I understand what you mean.
And they certainly look toward technology as an enabler of what they're trying to do. So it's not like a lot of commercial enterprises and healthcare enterprises in specific. It's not their primary mission or objective, but it certainly helps make the work much easier and more efficient. And like healthcare, I know public health is very data rich. And so in order to make good decisions, you need the data and the systems in order to be able to manage it.
Well, in our small way, we've done business with the federal government, Department of Commerce, and not to put you on the spot, but we used to jokingly say that there was never any money for innovation. You know, that they had to go through budgets and allocations and votes and all those kind of things to be able to fund something. But all that is to say that it must be a challenge when you're trying to provide the most cutting-edge technology to apply it to a system in a way has to deal with the realities of the moment rather than looking at the possibilities of the future.
Yeah, it can be, and I think that one of the most interesting trends that has happened in the last year, especially in really looking forward, is that some of the budget cuts or expected cuts coming through the federal government especially is really forcing innovation into the conversation. So how do you do things better with less has become a real mantra within the federal government. And I think that technology, again, like some other industries, is really the way to help be more efficient and to be able to do more with less.
Well, people hear about the CDC in the news, but they may not understand the role of public health and its purpose, although I think you kind of covered it in an overview way. Can you tell us a bit more about the organizations that you work with and the work that they do?
Sure. So public health is really both the science and the practice of protecting the health of populations. So it's a lot of focus on prevention and control of disease and injuries. At the national level, CDC provides scientific leadership and a lot of funding to state and local public health departments, sometimes academic institutions and other organizations to advance the science and the practice of public health. Really, it's the state and local public health departments who are the front lines in carrying out those public health functions. So things like, planning, monitoring, disease outbreak investigations, a lot of education programs, sometimes research, and then even there's a regulatory enforcement component that the state and locals manage as well. So different states will have different service models, but generally the local public health departments will collect data, do interventions, and in close collaboration with their stakeholders, which are sometimes the state health department and CDC, and then other healthcare providers and community-based organizations. So maybe to summarize that, the best way to explain it is that public health really traditionally looks at populations, while healthcare organizations are more focused on individuals.
Well, certainly healthcare reform. I mean, we hear a lot about it being a priority for the nation. I guess from your perspective, with a lot of insight, you have some pretty strong opinions, one would guess. What do you see will be the role of say, public health in that transformation?
It's been an interesting the way that I expect it to change when I'm hearing CDC and other public health officials, and even if you look at the administration, what they're doing through HHS, the Department of Health and Human Services, because really that disparity of population versus individual focus that I just mentioned, there's really been a distinct line between healthcare and public health, but I think that line will blur over time. So generally the primary interaction between those types of organizations has been around things like notifiable diseases, so sexually transmitted diseases and dozens of others that are required by state law to be reported to public health. So when an outbreak is identified, public health will, may notify these healthcare providers to be the lookout for more patients or more cases. And as part of follow-up, then local public health officials may request medical records, and they want to gain as much information they can about these cases and about the individuals as part of an investigation. But that's really traditionally has been the extent to which the collaboration has occurred between those two types of organizations. But I expect really over the next few decades, as the baby boomers hit the healthcare system and likely will overwhelm our national resources, both in terms of dollars needed to pay for care as well as the trained clinicians needed to actually provide care. I think that the focus from both healthcare providers and public health is going to be on what works. So that is what type of prevention and treatment activities are not only effective but efficient or cost effective. So it can't be, a lot of times these programs and things are based on someone's gut feel or a lobbyist platform, and it really needs to be, there's a lot of more focus both with the organizations that we work with, and I know in the healthcare legislation on what works and getting very well documented research and data that really shows what our best practices and trying to implement those best practices across care as much as possible. So, for example, when the government not long ago changed its recommendations as to an age a person should be before starting to get mammograms or a prostate cancer screening, or how often one should get screened, it's really based on hard data obtained through these types of studies. And as through the healthcare reform, as accountable care organizations take form, they're going to begin to look at preventing and managing disease in a population. So like public health, they're going to want to know what interventions or most cost-effectively prevent disease and injury. So there may be dozens of ways to discourage people from smoking and the well-documented negative health effects that comes from smoking, but the question is what works and what works in specific populations. And so really I think the collaboration in the future between public health and healthcare organizations will become very, very important in that goal to really avoid disease and prevent injuries, and while still promoting early and effective treatment in a way that minimizes costs and achieves some level of quality.
So from a very naive perspective, I know that a lot of what is being discussed now is self-directed individual health care, where they want you to know more and understand more about what services you're being provided and the costs of those services and those kind of things. In a way, could one understand from what you're saying that from a public health standpoint, meaning the larger, more group population, will have to start thinking in terms of how to do better at diet or do better at healthcare in order to, from an overall general population standpoint, be quote-unquote self-directed?
Yeah, there's definitely the individual really affects positively or negatively their own health and their healthcare costs. And I think we're going to need to balance the more empowered health consumer in the future with what really is appropriate and effective care. So just because I read an article on the internet about a specific treatment doesn't mean it's the right treatment for me. And I think even if you throw in even more customized health care because of genomics and those types of things, it may become even more founded in data and what really is going to work for an individual versus what does not. But at more of a population level, it is going to be both a discovery about what works as well as an education and communication with the individual healthcare consumer themselves.
Well, and here we go again, education and communication in a political arena. You're talking about also even, I guess, influencing. I was joking about budgets and budgets for allocation for innovation. They're driven by the voting booth. So in a lot of cases, in a way, what we're talking about is the direction of where public health goes isn't just the research and the discoveries that you ultimately determine, but also the acceptance of that as it relates to the populace as far as being willing to support those decisions.
Absolutely, and that's always been a challenge to the public health organizations, and in order to try to affect and take those programs that they believe or in some cases know work, and really affect how the decisions that people are making.
Well, one thing for sure, I know that as far as Georgia is concerned, recently, over the last couple of years, we've really begun to self-identify the reality that health IT is where one of the industry clusters that Georgia really leads. We've had a couple of years of incredible summits here where the industry has gathered, industry, academia, and the medical community, and I think there's been a lot of excitement centered around that. Obviously, IT is expected to be an enabler of healthcare, but I don't know how much about the public health and the federal government area. What are the major areas of focus in technology for federal government clients?
Sure. Well, I'll mention three. So I think the first major areas really around cybersecurity, and the federal government's under constant attack, and even humanitarian agencies like CDC are under attack every day. And about 10% of SRA staff wake up every day and go to a job that's focused on cybersecurity. So, as a government federal contractor, it's important to the government given that level of attention. Some describe cyber attacks as really the next way that terrorists will wage war in the U.S. and our critical infrastructure. So just as someone planted a virus in Iran's nuclear power plant control software, our utilities grid and some of our other networks and systems, critical infrastructure, are really considered equally vulnerable. The second thing I'd say is cloud. So it's gaining momentum partially at the federal government level because the former federal CTO, Vivek Kundra, had a cloud-first initiative where all new systems that are being evaluated for funding are to be considered for appropriate or considered first for appropriateness for the cloud. So things like email and websites were the first area for the federal government to consolidate and consider purchasing as cloud services. And there's some hesitation among more other parts of the federal government, among more mission-critical systems moving to the cloud, because you really don't want a subcontractor to a subcontractor to be housing U.S. government data in an overseas data center or something like that. And, in the healthcare environment, breaches from remote data centers or outsourced data centers have happened to hospitals and also have been found to have been stored overseas. So, this HIPAA-regulated protected health information has been breached many times for similar kinds of models. So I suspect the same story will happen as things move to the cloud if deliberate steps aren't taken to protect the data in accordance with its sensitivity. And I'd say lastly that mobile devices are really the new 800-pound gorilla that the government is finally addressing. So while BlackBerry had a corner on the secure device market for some time, clearly Apple's operating system and Google's Android devices have such popularity now that they can't be ignored. So people like me are tired of carrying around a BlackBerry for work and another phone for personal, and Santa's bringing me a tablet. So the government is really looking, and their contractors are really trying to figure out how to secure these personal phones and tablets so they can be used on the network. And I think once that happens, it'll really further accelerate that trend, and the real trend, which is that anytime, anywhere access to information on mobile devices will be enabled.
Well, the layers and tentacles, it's just amazing. I think, unfortunately, from a populist standpoint, we look into it, and there's a lot of, I don't know about criticism, but I guess observations about the whole process of health reform and some of the government situation. But when you think about some of the, just marginally some of the things that you're talking about, and here you are an expert, I'm sure a lot of our listening audience understands a lot of what you're talking about. Many of them are just generalists who get it. But the reality of the bottom line is this thing is such a complicated problem. I guess one last question, and unfortunately, as a lot of our better interviews do, we're running out of time. But I've got to ask right now, what are the challenges of your government clients facing, other than what you've already described?
I think the biggest issue right now is budget, and people can argue about whether the government spends too much. I'm not here to take sides on that topic, but really the process by which the government spends money is broken because Congress, they can't pass a budget on time, and they haven't for years. And so what we have are so-called endless continuing resolutions that fund the government at last year's level. And the problem it takes too long for the organizational units within the government to make use of the money before the funds expire at the end of the fiscal year. And so there's a lot of uncertainty around the budget cuts that are expected, and the fact that they don't have their budget right now, it really makes it tough for the executives within the federal government and our clients to run an effective organization because they just don't know what level of funding they should be managing to. So I don't have a great solution for that or a suggestion other than to call your representative in Congress, and because it is a major challenge and it's affecting how our government really runs and runs effectively.
Challenge is a good word. I'll end it on that. Wayne, thank you so much for taking time out of your busy schedule. What a great dynamic opportunity as far as a career path is concerned. I think the Chinese said, what's the wish? Live in an interesting life, and that can be both a challenge and a blessing. You are obviously in a great location as far as vision and opportunity, and it sounds like the right man in the right place. But again, Wayne, I'm truly impressed by what you guys are doing at the SRA, and thank you so much for taking time out of your schedule to join us today on Tech Talk.
Sure. Thank you for the opportunity to talk.